And it's just a quick walk, 1 or 2 steps, just to see the...
Okay.
I got you. I wouldn't say that's the best walk. Of course it's going to be stable. For God's sakes, you could barely walk when you came in here.
Oh, yeah. Exactly.
You're walking, in case you haven't noticed.
Yeah, noticed.
That's a big improvement.
Uh-huh. Well, basically, I was walking on the beach. You know, I like to take long walks. I live in Florida. And one day I just felt it was tight in my knee area. But I was still able to go for walks. And then one day I got a massage, and the person just moved my leg a little bit, nothing out of the ordinary. And I felt a twinge in my knee. And since that point in time, that was a couple weeks ago, there's been pain in the knee, more pain than before. Before I was able to walk still, even though there was tightness in the knee. And then I came up here to Toronto, and I was limping a little bit more. And basically, yesterday I woke up in the morning, and for the first time I couldn't put any pressure on my right leg. I rested for a day, and I can actually put my foot on the ground and stand up, but I still, it's too painful to walk.
For a sec, Richard, just for... And it's just a quick walk, 1 or 2 steps, just to see the...
Okay.
I got you. I wouldn't say that's the best walk.
I'm not going to be a runway model.
No, don't think so. And there's no way you could squat or anything at this point, right?
No. When I sit for a bit, I feel a lot of tightness in the knee. And then I, kind of move a little bit, and it loosens up some. There's one of these.
You got scars here.
Right.
You got something here. You got something here.
Yeah, that's a scar.
You got something here. Yeah. I mean, this is all fascially going to cause a lot of problems. And close. Second point, we're going to angle upwards, small intestine 18. Open. Close. Yep, let's stand up and see how it puts your weight on it.
A little better. Yeah, definitely better.
Quite a bit better.
Yeah, definitely.
So we're about half better right now, but his patella is still off track. So we're going to do some local work now. It actually looks like a normal knee now.
Yeah, it actually feels like it wants to move in.
Yeah.
I appreciate that.
Now stand up and try it. It's moving a little bit. The odd stumble, but much better. Try one more time.
And I can. Really
of course, it's going to be stable. For God's sakes, you could barely walk when you came in here.
Oh, yeah. Exactly.
You're walking, in case you haven't noticed.
Yeah, noticed.
That's a big improvement.
Yeah, when I came in, I was on crutches, and I couldn't walk at all. And after the treatment, I'm able to do some walking. The knee is still tender, and there's the odd hobble, but I'm at least starting to walk now. So that's a really nice, very nice improvement. Okay, so I was here 2 days ago, and I couldn't put any pressure on my right leg. I was using crutches and hobbling around. And then after the treatment, I was marginally using the crutches. By the next morning, I didn't really need the crutches. I was using them very slightly, just in case. And I was able to walk. By later in the day, I was able to walk without the crutches, not using them at all. And so the same thing. And here
It was a knee problem, right?
Yeah, it was the knee. Yeah, I had pain.
Well, stand up and see how you feel.
Yeah, I had pain in my knee.
And lift your knees up.
I couldn't stand up like this.
You're still pretty hesitant there.
Well, you were hobbling around there, aren't you? You'd be hesitant too. It's like, what?
Yeah, but you're so much better now.
Oh yeah, it's like night and day.
Just take a little walk and see how much.
Okay, so you wanna. Yeah, now it's even better because I was a little bit hesitant walking.
Right.
And so now it's a little sore still, the right knee, but I'm more fluid than I was. It was a little jerky. I'll go this way. It was a little jerky before when I came in, but now it's even slightly smoother.
You pretty happy about that?
Ecstatic.